I mean, imagine a microscopic view of your own bloodstream right now. Like to you, you're just listening to this deep dive, going about your day, feeling perfectly fine.
Yeah, completely normal.
Right. But to a biochemist, your bloodstream is this highly regulated transport system. And according to the medical transcript we're really digging into today, for, well, 1 in 3 adults listening right now, that transport system is quietly carrying a cardiovascular wrecking
A
ball.
literal wrecking ball.
And the most staggering part, like 80% of the people carrying it have absolutely no idea.
Wow.
Yeah. So we are looking at the silent, massive health crisis of prediabetes today. And the source material we have is essentially a survival manual that's just hiding in plain sight.
It genuinely is a survival manual. And, that statistical disconnect you just highlighted, the 80% who don't know, that's the crux of the entire issue.
Right, because if you don't feel it, you don't think it's there.
Exactly. We are so conditioned to associate disease with symptoms. Like, if nothing hurts, if you aren't feeling fatigued, you just assume your metabolic engine is running smoothly.
Yeah, that makes sense.
But the transcript just shatters that illusion.
Hmm.
Takes a really hard look at the gap between feeling fine and actually being, metabolically secure.
Which is terrifying, honestly.
It is. And while the numbers we're going to look at are sobering, the ultimate mission of the author and really of our discussion today is to remove the blindfold.
Right, to give you the power back.
Exactly. It's about giving you the exact biological blueprint to take control before a doctor ever has to, write you a prescription.
Okay, let's unpack this. Because we
Yeah.
really need to define the boundaries of this danger zone before we can understand the mechanics of how to fight it.
Yeah, we need the baseline.
Right, so the text builds its entire argument around very specific fasting blood glucose levels. So if you test your blood first thing in the morning on an empty stomach, the document defines the normal, healthy baseline as being between 3.3 and 5.7 millimoles per liter.
Precisely. That 3.3 to 5.7 window is, well, it's the metabolic sweet spot.
Okay.
At that level, your pancreas is producing the appropriate amount of insulin. Your cells are highly sensitive to that insulin, and glucose is seamlessly moving out of your blood and into your muscle and liver tissues for energy.
So the whole system is just in perfect harmony.
Exactly. It's working exactly as designed.
But on the far end of the spectrum, the text notes that if your fasting glucose crosses 7.0 millimoles per liter, you cross the diagnostic threshold for full-blown type 2 diabetes.
Right. That's the clinical red line.
But the entire focus of this document is the gray area in between, right?
Yeah.
That critical intermediate window of 6.0 to 7.0 millimoles per liter. That is the stage of prediabetes. And the prevalence metrics laid out in the text are just staggering. Like in the countries referenced by the speaker, 1 in 10 adults has full-blown type 2 diabetes.
Which is already a huge number.
Huge. And half of them don't even know it.
Yeah, I mean, a 50% unawareness rate for a definitive chronic disease is a massive systemic failure all on its own.
It really is. But the prediabetes numbers are where the real crisis lies. Like 1 in 3 adults sits in that 6.0 to 7.0 range. 1 in 3.
It's everywhere.
And an astonishing 80% of those individuals are entirely in the dark. Now, we know that clinical diabetes is a major cardiovascular risk factor, but what really caught my attention in the source material is the assertion that prediabetes carries the exact same vascular risk.
Yes, that's the part that shocks people.
It shocked me. Like, I always assumed that sitting at, say, a 6.5 was just a warning track, like a yellow light or a check engine light on your dashboard.
Right, like you're getting close to danger, but you aren't in it yet.
Exactly. But the author insists the damage is already happening. So how does mildly elevated glucose actually degrade the vascular system before you even hit clinical diabetes?
Well, what's fascinating here is that we often think of glucose merely as fuel, just energy for the body.
Right.
But in excess, glucose is actually highly reactive. When your blood sugar is chronically hovering in that 6.0 to 7.0 range, those extra glucose molecules don't just float around benignly.
What do?
They begin to literally attach themselves to the proteins and lipids that make up the delicate inner lining of your blood vessels, the endothelium.
Wait, so it's actively altering the structure of the blood vessel?
Exactly. It's an active process called glycation. And when glucose binds to these endothelial structures, it creates what are known as advanced glycation end products, or quite fittingly, AGs.
AGs, wow, okay.
Yeah, and these compounds engine massive oxidative stress and inflammation. The blood vessels, which are supposed to be flexible and smooth and responsive, well, they become rigid and inflamed.
Yeah.
It's basically like pouring microscopic glass into the system.
Microscopic glass. That fundamentally shifts how we should view that 6.0 to 7.0 range. I mean, it isn't a safe waiting room where you just keep an eye on things. It's an active hazard.
It is an active state of cardiovascular degradation. The text emphasizes that being in this pre-diabetic state massively increases the risk of what the author terms cardiovascular catastrophes.
Catastrophes? Like what?
We are talking about heart attacks, strokes, atherosclerosis, which is the hardening and narrowing of the arteries, and angina.
So the heart issues start early.
Right. The common misconception is that the endocrine issue, the insulin resistance, has to fully break down into diabetes before the heart issues begin.
But that's not true.
Not at all. The reality is the cardiovascular clock starts ticking the moment you enter prediabetes.
Wow. Okay, so if the vascular endothelium is actively degrading at a 6.5, that makes the invisible nature of this condition infinitely more dangerous. Which brings us to the demographic profile. Because if 80% of people don't know they are in the crosshairs, who exactly should be assuming they're at risk? And the source provides a very specific physiological and lifestyle checklist for this.
It does, and it's a profile that unfortunately captures a massive segment of the modern adult population.
Yeah, it really does. So the text outlines 5 core risk factors. First, age being over 40 significantly changes the metabolic landscape.
Right.
Second, biological sex. Males face a statistically higher risk. Third, excess weight, specifically indicated by a high body mass index. Fourth, high blood pressure. And fifth, a sedentary lifestyle.
That's the list.
And the author states unequivocally that if you have even one of these factors, your risk profile is dangerously high. Just one.
Yeah, but we also need to look at how those factors act synergistically.
Right.
It's rarely just one.
True, they kind of gang up on you.
Exactly. The combination of excess weight, particularly visceral fat around the organs, and a sedentary lifestyle directly drives insulin resistance at the cellular level.
How so?
Well, when you don't move enough and you carry excess adipose tissue, your cells literally begin to ignore the insulin signaling. The door to the cell stays locked.
Oh, so the glucose can't get in to be used as energy.
Right. So the pancreas pumps out more insulin, trying to force it, but the glucose still backs up into the bloodstream, pushing you steadily into that 6.0 to 7.0 danger zone.
And here's where the transcript takes a very sharp, almost uncomfortable pivot into how we view the medical establishment.
Oh yeah, it doesn't hold back here.
Not at all. Because normally you read a list of risk factors like that, and the default societal assumption is, well, my doctor will catch this at my annual physical.
Right.
Like, the healthcare system has protocols to screen me and keep me safe.
That's what we all want to believe.
But the source delivers an incredibly grim assessment, arguing that preventative medicine is practically non-existent.
It is a stark critique of the modern medical infrastructure. And we should be clear that this is the distinct perspective of the source text.
Right.
But if we analyze the underlying structural reality of that argument, it highlights a profound truth about how modern medicine actually operates.
The author phrases it almost brutally. Like, the text states that the government and the healthcare system are not invested in your long-term survival, pointing out that nobody is interested in paying you a pension for 30 years.
Yeah, it's a harsh way to put it.
Very. The implication is that the system is perfectly content to let you work, retire briefly, and then quietly expire.
Yeah.
Now, setting aside any, malicious intent, it is true that relying on an overtaxed system to proactively manage your subtle metabolic drift is a fatal error.
That is the core of the argument right there. Modern healthcare systems are marvels of acute care. Like if you have a heart attack, the surgical interventions available today are miraculous.
Oh, definitely.
And if your pancreas entirely fails, synthetic insulin regimens are incredibly sophisticated. But the system is fundamentally reactive.
Right. It waits for the crash.
Exactly. It is built to treat the catastrophe after it occurs, not to hold your hand while you slowly drift from a 5.5 to a 6.5 over the course of 5 years.
It's like installing heavy-duty shock absorbers on a car to handle the massive potholes rather than just paving the road in the first place.
A perfect way to look at it.
Yeah.
The author uses a powerful philosophical anchor here. They say, the salvation of drowning people is the work of the drowning people themselves.
Save yourself.
Save yourself. Because if you wait for the medical system to officially diagnose you, to wait until your fasting glucose crosses that 7.0 threshold and the clinical alarms finally go off, you have waited too long.
Because the microscopic glass has already been in there for years.
You've already sustained years of silent cardiovascular damage. The system will absolutely deploy its resources to catch you when you fall off the cliff, but it will do practically nothing to stop you from walking right up to the edge.
So what does this all mean, like, for the listener? If the system is reactive, and statistical probability is that a huge portion of us are walking around with this active cardiovascular damage without knowing it, how do we operationalize this save yourself philosophy?
Well, the source material doesn't just diagnose the problem. It transitions into a very specific, accessible toolkit for survival.
Okay, yes. Because it argues that anyone who tips those risk factor boxes over 40, excess weight, elevated blood pressure, sedentary habits, is obligated to take radical ownership of their metrics.
Completely.
And the text mandates 3 specific measuring devices that must be in your home.
Right, let's go through those.
So let's go through the survival kit. The first 2 make perfect sense to me. Number 1 is a simple set of scales. You can't manage what you don't measure.
Yeah.
And tracking your weight to calculate your BMI is the frontline defense against developing that visceral fat we talked about. Number 2 is a tonometer, or, a blood pressure monitor. Given that prediabetes is ultimately a vascular disease, tracking the pressure against your arterial walls is non-negotiable.
Yeah, and both of those are fundamental, they're cheap, and universally accepted as standard household items. Nobody thinks twice about having a scale.
Right. But the third device is where the friction lies. The author insists every at-risk person must own a glucometer, a home blood glucose meter.
Yes.
Now, I understand the clinical utility, but we have to acknowledge the psychological barrier here. Like, for decades, blood sugar monitoring has been gatekept behind a clinical diagnosis. People associate finger pricks with disease management, not proactive wellness.
It feels like an escalation.
Exactly. It feels like crossing a medical threshold that most people want to avoid at all costs.
But this raises an important question. Why are we so intimidated by our own biology?
That's a good point.
You are touching on the exact hesitation the source material aims to dismantle. People view the glucometer as a complex, painful medical procedure. But the text systematically demystifies the technology, proving that in the 21st century, it is closer to basic biohacking than it is to clinical surgery.
Here's where it gets really interesting, because the author actually breaks down the process to prove how incredibly elegant it has become.
It really is simple.
Right. It's not a chemistry set. You wash your hands, basic hygiene. Then you use a lancet, which is the device that makes the prick. And what stood out to me is that modern lancets are adjustable.
Yes, that's key.
You literally dial in the depth based on the thickness of your skin. It's a microscopic, sterile puncture, not a hypodermic needle.
The precision of the technology removes the pain factor almost entirely. And the meter itself does all the computational work.
You don't have to guess.
No, you insert a sterile test strip. The device auto-calibrates. You touch the edge of the strip to the tiny drop of blood, and capillary action just draws it in. It takes mere seconds for the digital readout to appear. The entire process takes less than a minute.
And the speaker in the text actually demonstrates this live, which I thought was a brilliant rhetorical move. He tests himself and gets a reading of 5.9 millimoles per liter.
Now let's analyze that 5.9 because context is everything in metabolic health.
Right, because earlier we established that normal fasting glucose maxes out at 5.7. So a 5.9 looks like it's creeping into the pre-diabetic danger zone.
But the crucial context provided by the speaker is that he was not fasting.
Ah.
He had consumed breakfast roughly 2 hours prior. A postprandial or post-meal reading of 5.9 is exceptionally healthy.
Okay, so a spike after eating is normal?
The human body naturally experiences a glucose elevation after digesting carbohydrates. The point of the author's demonstration wasn't just to share his personal metrics. It was to prove the sheer accessibility of the data.
Yeah, that makes sense.
For the cost of a few cups of coffee, you can purchase the exact same diagnostic power that used to require a phlebotomist and a lab.
It completely reframes the tool. Like, the thesis isn't to buy a glucometer once a doctor frightens you with a diagnosis.
Yeah.
The goal is to buy it before you have a reason to be frightened.
Yes.
To use it to confirm that your metabolic engine is running smoothly, or to detect the smoke before the fire burns down the house.
It is the ultimate act of personal accountability. Once you realize the barrier to entry is practically zero, the excuse of ignorance just evaporates.
Okay, so let's walk through a scenario. Let's say I fit the profile. I'm a 45-year-old male. I sit at a computer for 8 hours a day, and my BMI is creeping up.
Very common scenario.
I take the advice, I buy the glucometer, I wake up tomorrow, I fast, and my number comes back at 6.5.
Okay.
I am officially standing in the pre-diabetic danger zone. What happens next? Am I just looking at a crystal ball showing me a future of daily medication and cardiovascular decline?
That is the pivotal moment of the entire deep dive. The natural assumption is that a 6.5 means your fate is sealed. But the source text is emphatically clear: your trajectory is not fixed.
It's not too late.
Not at all. In fact, the pre-diabetic stage is the exact window where you have the maximum leverage to reverse the pathology entirely.
And the author draws a fascinating line in the sand between the pharmacological approach and the lifestyle approach at this specific stage.
Yes. The text is very objective about the medical tools available. Like, if you progress past the 7.0 mark into full type 2 diabetes, there are undeniably effective medications that modulate carbohydrate metabolism and attempt to mitigate those cardiovascular catastrophes we discussed.
But there's a catch with the meds.
You have to understand the nature of that intervention. Those drugs are designed for lifelong management. You are essentially medicating a chronic decline.
You're managing the symptoms of the broken transport system, but you aren't actually fixing the delivery mechanism itself. But the text argues that on the stage of prediabetes, lifestyle correction isn't just a nice, supplementary idea to run alongside medication. It asserts that behavioral intervention is fundamentally more effective than most pharmacological drugs.
Let that sink in. At this critical juncture, your daily choices possess more chemical authority over your biology than a prescription pad.
That is incredibly empowering. It elevates eat right and exercise from a generic health platitude into a targeted medical intervention.
It becomes a prescription you write for yourself.
Exactly. And the author lays out a 3-pillar blueprint for reversal: optimizing the diet, eliminating excess weight, and incorporating adequate physical activity.
Right.
I want to drill down into the mechanics of this because I think we often lose the biological why behind these behavioral changes. Like, let's start with the physical activity. We aren't just talking about burning calories on a treadmill to look better, right? What is actually happening in the muscle tissue that directly combats a 6.5 blood glucose reading?
This is where human physiology is truly remarkable. So skeletal muscle is the primary consumer of glucose in the human body.
Okay.
Normally, muscle cells require insulin to unlock their doors and let glucose in. However, when you engage in adequate, strenuous physical activity, you activate a completely different physiological pathway.
Really? A different pathway entirely?
Yes. Muscle contraction forces specific transport proteins known as GLUT4 receptors to move to the surface of the cell and pull glucose out of the bloodstream without the need for insulin.
That is amazing. So by contracting the muscle, you are creating an insulin-independent glucose sink.
Exactly.
You are physically clearing the excess sugar that is causing the oxidative stress in your blood vessels, and you're bypassing the broken insulin mechanism entirely.
Precisely. You are giving your overworked pancreas a break while simultaneously dropping the vascular hazard. And when you pair that with the second pillar, eliminating excess visceral fat, you compound the healing. Fat stored around the internal organs actively secretes inflammatory cytokines that block insulin signaling.
So the fat is actually sending signals to keep the doors locked.
Right. So as you shed that specific weight, the cellular locks begin to clear. The cells regain their sensitivity to whatever insulin your body is naturally producing.
And the diet optimization is the final piece of the triad. By reducing refined carbohydrates and simple sugars, you stop flooding the system in the first place.
You fix the input.
Exactly. You reduce the input, you fix the cellular receptors by losing the visceral fat, and you increase the output by building muscle to soak up the glucose. It's a perfect mechanical fix.
It really is. And if we connect this to the bigger picture, the outcome of executing this 3-pillar strategy during the pre-diabetic window is profound.
It's life-changing.
The text doesn't just promise symptom management. It states that you can completely stabilize your carbohydrate metabolism. You can arrest the progression of the disease, avoid crossing that 7.0 threshold into full type 2 diabetes, bypass the lifelong dependency on synthetic medications, and crucially reclaim a decade of normal, healthy life.
10 extra years of life.
10 years.
Not by waiting for a revolutionary new drug, but by catching the systemic failure early and applying biological leverage. It just redefines what preventative medicine actually is. Like, it's not a service a hospital provides for you. It is a discipline you enact for yourself.
It is the ultimate manifestation of the author's philosophy. The tools, the scale, the tonometer, the glucometer, they're cheap and widely available.
Yeah.
The biological mechanisms to reverse the damage are built into your own anatomy. The cure, at the pre-diabetic stage, is entirely within your grasp. But none of it can be activated until you know your numbers. You cannot defeat an enemy you refuse to measure.
This has fundamentally changed how I view metabolic health. Like, we started this deep dive talking about a massive invisible crisis where 80% of the people affected are living in the dark.
Right.
But we are walking away with a highly specific, actionable diffusal manual. This isn't just an academic discussion of a medical transcript. It's a call to action.
It absolutely is. Yeah.
If you meet the risk profile, if you are over 40, if you carry extra weight, if your lifestyle is sedentary, the time for guessing is over. It is time to go to the pharmacy, pick up a glucometer, and map out exactly what is happening inside your own vascular system.
And, I want to leave you with one final provocative thought that builds directly on the core challenge of the source material.
Okay, what is it?
Let's say you take this entirely to heart. You buy the device, you test your fasting glucose tomorrow morning, and the screen reads a perfect 5.2. You are metabolically secure, you breathe a massive sigh of relief.
That is the ideal outcome. The system is working.
It is. But don't just put the device in a bathroom drawer and forget about it. Look at the people in your life. Look at your siblings, your parents, your friends, your colleagues.
Right, because they might be in the dark.
Exactly. Who among them is over 40? Who has high blood pressure? Who works a desk job? Statistically speaking, someone you love is currently sitting in that 80% demographic.
That's a heavy thought.
They're walking around right now believing they feel perfectly fine, while their vascular endothelium is quietly degrading.
Because they haven't experienced the clinical catastrophe yet. They don't know they're in the danger zone.
Exactly. But you already hold the tool. You already know how painless, cheap, and elegant the technology is.
Yeah.
Could you, taking just 1 minute of your time to demystify the process and test their fasting glucose, be the exact intervention that changes their trajectory?
Wow.
Could your willingness to share this $20 piece of technology be the catalyst that saves them from a heart attack 5 years from now? That is the true power of this knowledge. Taking ownership of your health is the first step, but opening the eyes of the people around you is how we actually combat the statistics.
What an incredibly powerful perspective to end on. The glucometer isn't just a diagnostic device, it's a tool for community care. The ability to intercept a chronic disease before it takes root is literally sitting on the pharmacy shelf. Thank you to everyone for joining us on this deep dive. Don't wait for the system to tap you on the shoulder. Take control of your metrics, ask the hard questions about your biology, and share what you learn. We'll catch you next time.